with our little babies who always put things in their mouths. So we have different types of poisonings, which we're going to go into in terms of like the most common. But this right here, this video is just very general. So you have different types of drugs, household products. The biggest thing that we can do for your pediatric patient is bring them into the ER, and first things first, ABCs is always number one. So we do ABCs. Now for our signs and symptoms and our patient assessment, our first intervention is always ABCs. Your vital signs, your signs and symptoms, your physical assessment, all going to vary on substance to substance, which we'll get into the next video. But you might have an increased heart rate, decreased heart rate, increased respirations, decreased blood pressure, or increased blood pressure. Really just depends on how your patient's responding. Confusion, coma, or seizures with any type of intoxication. So the biggest thing is we have to get the ABCs. Number two is call the poison control number. Yes, at the hospital we call the poison control. And we want to know pretty much what the little baby took, when they took it. The big one is when. The big one. Because that's going to determine our intervention, and I'll explain right now. And also the amount of what the patient took. And I say the big one is when, because we want to know, has the GI tract absorbed it yet, or can we give your patient something to either take it out or to absorb it so it doesn't go into your patient's body. Now the two biggest ones we do is a gastric lavage. All we're doing is putting the tube down into the tummy, and we're pumping water in there, and a lavage is we're pushing cold water in there to wash out the GI tract. We'll suction it back up. This has to be done between 1 to 2 hours. The rule of thumb is you have to do an intervention, especially for a poisoning patient, if you want to absorb any of the poison within the first 2 hours. Same thing with activated charcoal. Activated charcoal we use a lot in the in the emergency room. And I used a lot in my paramedic days. So activated charcoal will get your teeth all black, but the little charcoal, it's actually charcoal. Like the same stuff, well, not the same stuff, but the same properties that we use for barbecues and stuff. But charcoal itself helps to absorb any type of poison inside the GI tract. Now, if the poison's been sitting there for a long time and it's already absorbed, we can't do anything. It has to be within the first 2 hours. So it'll absorb it from the GI tract, and the charcoal will hold on to it and pass it through your stool so your body doesn't absorb it. So that's the cool bit. Let's see here. We want to prevent, the last thing here, we want to prevent your patient from vomiting or inducing themselves to vomit. Usually parents will think that it's good for them to throw up a poison. And usually it really just depends on which type of poison it is. Because if it's something corrosive, like let's say gasoline, it'll be corrosive on the way back out. So we want to cause minimal damage to the GI tract as possible. So let's go into the specifics. We're going to do aspirin, Tylenol, and lead poisoning. So we're talking about poisonings right now. We have the three major poisonings. We have salicylate, acetaminophen, aka Tylenol, as well as your lead poisoning. Lead poisoning was really big back in the 60s, and I think it lasted all the way until the 80s, because they used to make paints with lead byproducts in there. And Have you ever heard the saying, have you ever, ate lead chips as a child? Lead chips basically meant that kids would eat these little pink chips and they get lead poisoning and then they go cuckoo in the brain. So, yeah. So let's get to our first one here. Salicylate. Now, salicylate is another fancy word for the main active ingredient inside of aspirin or other NSAIDs, non-steroidal anti-inflammatories. So not only aspirin, but also ibuprofen. Now, they've started to make child locks on these over-the-counter drugs because we had a lot of pediatric patients being overdosed and eating them like they were candy. So they become toxic when we have between 105 to 200 milligrams per kilogram. And if you guys remember kilos, 1 kilo is 2.2 pounds. It's an aspirin. It's the main active ingredient in aspirin and NSAIDs, and also a lot of cold remedies. Now, there's 3 phases of toxicity. The first phase is you're having increased respiratory rate. Your body's blowing off a lot of CO2. So your body's going to turn alkalytic, basically basic. So we're doing alkalosis, respiratory alkalosis. If you guys haven't seen my APG video, then you have no clue what I'm talking about right now. But your body has a very fast respiratory rate in the first phase. So you have hyperventilation. You're blowing off a lot of your CO2, and you're causing inadequate oxygen exchange. So we have a decreased level of consciousness, which could lead to coma as well as respiratory failure. Now, since it is an aspirin, we know aspirin is an antiplatelet congregator, not an anticoagulant. Anticoagulants are your Coumadin and your heparin. This is an antiplatelet congregator. So we're going to give vitamin K. Let me see here. And we know that vitamin K is our reversal, especially for our Coumadin. And Coumadin is our anticoagulants. Vitamin K helps to clot the blood. Aspirin is what your patient has taken, so it's salicylate. And we give vitamin K to clot the blood. And just remember, side note, CK, like Calvin Klein, Coumadin, we give vitamin K for your patients if we give them too much heparin. Protamine sulfate for your patients if we give them way too much heparin. So we're going to give vitamin K for aspirin, giving too much aspirin or too much salicylate, okay? So vitamin K and fluids. Let's talk about acetaminophen overdose here. Acetaminophen, aka Tylenol, is our next poisoning here. We have an increased risk for liver damage with our acetaminophen patients here. If you guys remember anything about the liver lectures, or if you have seen the liver lectures, when you take any medication, I explained in the liver lecture that your liver acts like a customs agent, or let's say you're crossing the border. They make sure that everything that you take in from your mouth, before it goes to the bloodstream, your stomach absorbs it and sends it to the liver to be filtered. So with your medications, especially our acetaminophen, it goes to the liver, what's called the first pass phenomenon. And this liver, acetaminophen, beats up the liver big time. The only other thing to really kill the liver is alcohol, spring break, doing all that crazy stuff, doing the beer bong, right? Okay, that's where we get our hepatic failure. So when you have patients who are, let's say, in their teens, they break up with their boyfriends or whatever, they take a huge bottle of Tylenol, you're talking liver damage for the rest of their life, and probably a liver replacement. So very, very sad. But anything that causes liver damage, that's just the signs and symptoms and the clinical manifestations are. So we know that liver creates bile, and what does bile do? Bile puts your bilirubin on the bus. What is bilirubin? Bilirubin is a digested form of hemoglobin. What the heck is hemoglobin? Hemoglobin is your red blood cells that were broken down in the spleen, and now they did exit the body. So your spleen turns hemoglobin into bilirubin. Bilirubin puts it on the bus, your bile bus, and bile is excreted into the small intestine, your duodenum. And that bile goes throughout your intestine and pulls out excess cholesterol. Cool? So we're going to have jaundice, which is just fancy words for too much bilirubin. If we don't have bile being created, there's no bus to transport bilirubin out of the body. So Billy has to walk, and he walks inside the bloodstream, and that's where we get our yellow jaundice patients. We have liver failure, obviously. We have nausea, vomiting, which is pretty much generally every diagnosis is nausea, vomiting. But you're going to have the liver labs are going to be all crazy and wacko. So you're probably going to have your ALTs and your albumin is going to be low because we know that your liver does A, B, and C. A is it creates your albumin, B, your bile, and C, your coagulating factors. So the first sign you're going to see is jaundice. The next sign is probably your albumin's going to be lower, and then your coagulating factors, your thrombin and thrombinogen are going to be off, and your patient's going to have longer bleeding time. So what do? Our major antidote is your mucomist. Now, what is mucomist? Originally, mucomist, it sounds like it's taking mucus with a mist, right? Usually we give this to our lung patients, our lung condition patients that have too much mucus in their lungs. And it helps break up the mucus. We give it to them via breathing treatment. It helps break up the mucus and helps them cough it out. And it smells horrible like eggs. But they were finding out that mucomist actually helps to bind to different substances in the bloodstream and aids their excretion. There are two things that they found mucomist helps with. It helps with your acetaminophen overdoses, your Tylenol overdoses, as well as your patients going to the CAT scan room and are going to be injected with contrast. It helps to protect the kidneys. So those are the two biggest areas you're going to see mucomist in that's kind of like its off-label use. So the antidote is mucomist for your Tylenol patients. And just remember, side note, if your patient goes to CAT scan, they're probably going to get a mucomist to protect their kidneys if they have any type of renal issues. So for instance, if your patient is on, let's say, a diabetic who's on metformin and they need to do a CAT scan with a contrast, they're probably going to get mucomist to protect those little kidneys. But that's a whole other subject in and of itself. Let's do the last one, lead poisoning. Lead poisoning is our next subject here. So as I was saying in the beginning, lead poisoning used to be really, really big when they used to make paint with lead. There are houses that are still here today with lead paint, but not as common as the older generation. So if your patient has lead poisoning, what's bad and what's really bad? Well, we know that anything greater than 10 in terms of our milligrams per deciliter is considered a health hazard. Anything greater than we have symptoms that are appearing in our patient. So when your patient ingests, let's say, a lead paint or a lead paint chip or a lead pencil, I don't even know if they still have lead pencils anymore, but it deposits into the bone, in the soft tissue, as well as the blood. And what happens is it gets your patient clumsy, irritable. It affects your central nervous system, couldn't even cause seizures, and behavior changes. And a lot of the times in the old days, we used to just think that it was a behavioral problem with the patient themselves, not knowing that it was a lead poisoning, and we just classify it as an attention disorder or something like that. But attention span is hugely affected with our lead poisoning because it affects the central nervous system. So we give chelating agents for our lead detox. Chelating agents are agents that pull heavy metals out of our body. And we're not talking about type of heavy metal. It's just like our lead heavy metal, and it's going to be pulling it out of your body. So those are the things for your poisonings. Let's get into Lyme disease.